for our COVID-19 media update. A great group of speakers with us. We have Dr. Rachel Herlihy, State Epidemiologist for CDPHE, Kate McIntyre, Deputy Director, State Vaccine Task Force, Dr. Laura L. Klein, Medical Director of Maternal Fetal Medicine at UC Health Memorial Hospital in Colorado Springs, and Robert Worthwine, Director of the Office of Behavioral Health for CDHS. And so with that, I'm going to go over to Dr. Rachel Herlihy.
All right, good morning, everyone. Before I get into the details of our current epidemiologic trends, I do want to provide you with a quick update on variants in Colorado. We do have our first identified cases of the B.1.617.2 variant in Colorado. Last night, we had 5 reports of that variant reported to us in Colorado. All of those are cases that are being reported to us from Mesa County. So the B.1.617.2 variant is one of the variants that was first identified in India. At this point, it is classified as a variant of interest, meaning that we are still trying to learn more about this particular variant. So that is the classification system that CDC is using. If you remember some of the other variants that we talk about, so the B.1.1.7 variant or the B.1.351 variant, which is the South African variant, or the P.1 variant, which is from Brazil, those are all considered variants of concern. So that next sort of level of classification of concern that CDC is using. So again, this variant right now is considered a variant of interest, and we're trying to really learn a little bit more about this particular variant and what sort of aspects of it could potentially be more concerning. So whether it could potentially be more transmissible or have other concerning characteristics about it. But moving on to our epi data. So this figure is showing you our current epidemiologic trends in the state. So each of those gray vertical bars you see are our daily case counts, and that red line is showing you our overall 7-day trend. And so what you can see in this slide, if you look to the far right here, is that we have seen just a couple days now of a decreasing trend. Certainly good news to see that, but I think it's still too soon for us to know if that's going to be a lasting trend. At this point, I would say that we continue to see, a high level of disease transmission occurring in the state, probably a high plateau. And I think it's going to really take several more days worth of data for us to feel confident in being able to say that we are seeing any sort of a decrease in cases in Colorado. Next slide. So this next slide is showing you a difference in some of the case trends that we're seeing in different age groups in the state right now. I shared some of this data last week as well. So very clearly what we are seeing right now in the state is that our highest rates of disease transmission are occurring among younger populations. So this figure is showing you that our highest rate of disease transmission is among 11 to 17-year-olds. So that represents middle school and high school students in the state. And then you can see that that next highest rate is among those over the age of 18 with a relatively flat trend. And then for 3 to 10-year-olds, so that would be preschool age children and elementary school age children, we see lower rates there, but we do see an increasing trend there. So overall, we are seeing the steepest increases in cases right now among those younger age groups. You can see a little bit of a bend that looks promising, a little bit of a flattening the last couple of days with those trends. I think, again, way too soon for us to feel confident that those numbers are truly stabilizing in younger kids in the state. And overall, we are seeing a little bit more of a positive declining trend in adults. So overall picture here is that we are continuing to see concerning trends in kids in the state, and that is clearly shown in the data we are seeing. Next slide. Hospitalization trends, we are not seeing a clear decrease or even stabilization in our hospitalization numbers at this point. We know that hospitalization data can lag a little bit behind case data, but we do continue to see this concerning increasing trend in hospitalizations in the state. You can see that we're at our highest number, 666 hospitalizations as of yesterday in the state. And those are really the highest numbers that we've seen since the winter here in Colorado. So certainly a continued concerning trend as far as our hospitalization rates go in Colorado. Next slide. I do also want to touch on some updated work that we have done to look at vaccine effectiveness in the state. So a couple of weeks ago, we did an analysis and shared information with all of you about the data that we were seeing as far as breakthrough cases that were occurring in Colorado. And when I talk about breakthrough cases, what I'm talking about are cases that are occurring among people who are partially or fully vaccinated. And so this is data showing you what we are seeing as far as rates of cases among unvaccinated individuals, partially vaccinated individuals, and fully vaccinated individuals. And we continue to see this clear trend where the lowest rates are really occurring in that fully vaccinated population. And by our analysis, we're seeing 92% protection against being reported as a case in Colorado when you compare fully vaccinated individuals to unvaccinated individuals. And that is very consistent with the estimates that we are seeing nationally from clinical trials and from other national studies as far as the overall vaccine effectiveness. And with that, I will hand it over to Kate.
Great, thank you. This morning, I wanted to start off by sharing again what the governor has shared, that we have reached over 2 million fully vaccinated people in the state, which is a milestone. That exact number is 2,060,305 people. And we calculate that at about 43.79% of our eligible population as being fully vaccinated. And so that means they've received either 2 doses of Pfizer or Moderna or the 1 dose of the Janssen vaccine. As far as 1 dose of Pfizer or Moderna, so partially vaccinated people across the state, that number is 2,688,062, and we're calculating that at about 57.13% of our eligible population. You can see on the slide here what we've received as far as all of the brands that I've mentioned, how many doses we've distributed. That's over 5 million doses distributed across the state. And then as far as what we've administered, 4,386,340 vaccines have been administered across the state to date. Next slide, please. So I just wanted to share the daily doses administered. As you can see, there is a steady downward trend. You'll note the dips in the graph are typically those Sundays. That's our lowest day of administration typically, as you can see. But I want to make the point that even though we're seeing some decrease in uptake at all of our community vaccination sites, as well as with our providers, we are still seeing a lot of folks being vaccinated, and our numbers are still pushing up. We administered over 35,000 vaccines through our community vaccination sites. And it's also important to note that as a state, we continue to order all of the available doses. We will be working with all of our providers to ensure that we have adequate storage for all of the doses. The most important thing is that vaccines are our ticket out of this pandemic. We want to encourage all Coloradans to get this life-saving vaccine, and having that vaccine on hand when folks want to go get vaccinated is really a big part of our strategy. So just a quick reminder that there are a lot of providers administering vaccines now. We have over 1,400 vaccine providers enrolled to give the vaccine. The Department of Public Health and Environment is working really closely with all of those providers to ensure the proper storage and handling. We're going to be enrolling even more providers as our vaccine supply increases. We do have a provider map online to try to, again, just provide easy access for folks who want to get vaccinated. And then we do have the 1-877-CO VAX CO. That's 1-877-268-2926 phone number available. That's 24 hours a day, 7 days a week in numerous languages, and folks can call to get the latest information on the vaccine types available, which one might work best for them, as well as where to get the vaccine. So that's all I have, and I'll hand it off to the next speaker. Thank you.
Great, thank you. And Dr. Klein, we would love to welcome you to our group today and have you talk about vaccine and pregnancy.
Great. Thank you so much for having me. I'm excited to be able to encourage pregnant women to get vaccinated against COVID-19.
Oh, Dr. Klein, you're breaking up just a little bit.
Ooh, I'm sorry. Can you hear me okay? Okay, can you hear me?
Oh, yes, that's much better.
Okay. Thank you so much for having me. I'm excited to be able to encourage pregnant women to get vaccinated against COVID-19. I'm a maternal fetal medicine physician at UC Health Memorial. I've been practicing here since 2006. My day-to-day job is taking care of high-risk pregnant women. So pregnant women who have either a maternal high-risk condition or a high-risk condition with the baby or the pregnancy in general. When patients ask me about COVID vaccination, I generally encourage them to get vaccinated. It is a personal decision that each pregnant woman has to make for themselves. And as healthcare providers, we really want to support them, whether they choose to get vaccinated or not, and to really give them all the information that we can. The COVID-19 vaccines are obviously new, and so we don't have huge studies of giving them to pregnant women and looking prospectively at how those women do. Those trials are in progress, fortunately. We do have data so far on about 30,000 women who have been vaccinated during pregnancy and have self-reported their information to the CDC. So far, those data are very reassuring. There's no signs of higher risk of any pregnancy complications in women who get vaccinated. That includes miscarriage, early delivery, low birth weight. So that's very reassuring. In pregnancy, we're very comfortable with vaccinating pregnant women. Things like flu shots are recommended for pregnant women every year. We recommend that all pregnant women get a Tdap vaccine in their third trimester. This actually helps to protect the baby in the first couple months of life from infection. We do know that pregnant women who get infected with COVID-19 are at higher risk of complications compared with women who are not pregnant. This can sometimes lead to really tough situations where pregnant women are in the ICU, needing to be on a ventilator, sometimes separated from their infants because they're too sick to even see their babies after delivery. So these are situations that those of us who have taken care of pregnant patients with COVID-19 really want to avoid. Looking at the way that these available COVID-19 vaccines work, there are not any biological reasons that I would be concerned about them having negative effects on the baby. What we're doing with the vaccines is really stimulating mom's own immune system to produce antibodies against COVID-19. Moms have all sorts of antibodies circulating in their bodies throughout pregnancy against various infections that they've either been exposed to or been vaccinated against in their life. Those antibodies are actually really protective for babies. They cross the placenta, get into the baby's bloodstream, protect the babies in the first couple months of life to help them fight infection before their immune systems have fully matured. So the only vaccines that we stay away from in pregnant women are live virus vaccines. That would be things like measles and chickenpox, but none of these available COVID-19 vaccines are live virus vaccines. There's not any risk of them infecting the baby, affecting the baby's DNA, anything like that. So I generally really encourage my patients to get vaccinated when they're able. So thanks so much for having me, and I'm happy to take any questions later on.
Thank you so much. And now we'll go to Director Worthwine to talk about Mental Health Awareness Month.
Thank you. This year, we thought it was very important to make everybody aware that May is Mental Health Awareness Month. The Colorado Department of Human Services and our partners are proud to celebrate Mental Health Awareness Month. It's a national movement to raise awareness about mental health, fight stigma, and support the estimated 1 million Coloradans with behavioral health needs and their families. Thanks to our partners at CDPHE and the Colorado Department of Agriculture, as well as the Mental Health Colorado, in working with us and raising awareness to mental health as a whole. As you see on the slide, you have the our website here that you can go to and learn more about Mental Health Awareness Month and mental health more broadly in Colorado. Next slide, please. So behavioral health during the pandemic, there has been an effect, and we've seen an impact of the pandemic on the mental well-being of individuals. Our hotline has seen a 30% increase, the Colorado Crisis Services hotline, since the beginning of the pandemic. So over the life of it, we've seen between 30 and 35% increase in calls to our Colorado Crisis hotline. We also know that anxiety, depression, and thoughts of suicide are among our top reasons that people contact the Colorado Crisis Line during the pandemic. And crises are self-defined on those hotlines. So we really encourage anybody who is sort of saying, you know, I'm struggling, to call. You don't have to compare yourself to others. You don't have to compare your struggle to someone else's struggle. If you're struggling at all and you really need a professional to talk to, call the hotline. It's a free hotline. It's confidential. You don't have to share your name. It's available 24/7. That number is 1-844-493-8255. You can even text at 38255 to text talk to 38255. That's available for the Colorado Crisis Line. We also know that 1 in 4 young people are reporting significant stress related to anxiety, depression, worry, as it relates to during the pandemic specifically. So that is concerning and something that we're paying attention to as well, and making ourselves available to those young people as well. So next slide, please. There's lots of big initiatives happening in behavioral health right now that sort of address not only during the pandemic, but ongoing. We want to make people aware of the 988 implementation. This is a national suicide prevention lifeline that's going to launch July 2022. And my office, the Office of Behavioral Health, is planning for the rollout of 988. And we have a committee that's sort of going through all the ins and outs. It's really important to make aware that 988 is not yet operational. So please continue to use the Colorado Crisis Services line that we mentioned earlier. There's been a lot of press around 988, which is great. But we also want to make clear that it is not operational yet. Next slide, please. And another big initiative is the behavioral health reform. We know in Colorado, there's lots to do to be better stewards of taxpayer dollars in delivering behavioral health services to all Coloradans. We need to do a better job of serving our citizens throughout the state and being available and providing a really strong customer service approach to delivering behavioral health. So there's been lots of efforts through the years, but Governor Polis has created a task force to take a step back and take a holistic approach and recommend some real reform to the behavioral health system. We've spent many, many years sort of creating a Band-Aid approach to fixing things here and there. And it was really helpful to take a step back and think about what the holistic system reform needs to be. Last month, Governor Polis signed House Bill 21-1097 that establishes a behavioral health administration by July 2022. The Behavioral Health Administration will align, coordinate, and integrate state mental health and substance use programs and funding across the state so that we're being more strategic in how we deliver care across state agencies to the people of Colorado. Behavioral Health Administration will serve as the foundation for our reform efforts going forward, including expanding telebehavioral health services and shoring up a culturally responsive behavioral health workforce. We need more people in the workforce, and we need a more diverse workforce as well. Next slide, please.
All right, and with that, we're going to go ahead and start our media Q&A. Thank you all so much. So for this, we'll use the raise hand function. I'll go ahead and call on you. You can say which outlet you're with and your name. And then I would love to stick with everyone's first questions first before we go to follow-up or multiple questions, just so I can get through as many of you as I can in the time that we have today. And so I'm actually going to go ahead and start with Meg. I think that you might be on phone.
Okay, can you hear me?
Yes.
Great. I wanted to ask about the 5 cases of the latest discovered variant out in Mesa County. Sign yet? Are those connected, have those people traveled recently, or just unrelated cases?
Thanks, Maggie. You were breaking up a little bit, but I think I heard your question. So we, at this point, know that those individuals, none of them did travel outside of the county. The investigation, the EPI investigation is really still ongoing at this point to try and understand other risk factors and the connections that might exist between those cases.
Thank you.
Great, thank you. And I forgot a housekeeping item, totally my fault. If you have any questions that are outside of what we talked about today, go ahead and send those over to media_info@state.co.us, and we will help take care of them there. And so with that, we'll go with Seth. You're our next question.
Hi, thanks. Seth with the Gazette. Is Colorado's vaccine allocation going to change at all with the Biden administration's shift to focusing on allocation sort of based more on need? Is that going to affect this at all? Thanks.
This is Kate, and as far as we know right now, Colorado is continuing to order our full allocation. That's been pretty consistently around 290,000 doses. That's all the vaccine types combined each week. And so as of right now, we're not expecting that to change, and we're not expecting to place any lower than our full order possible.
Great, thank you. Chris, you're next.
Chris Vanderveen with 9 News. My question is back to the variant discovered in Mesa County. What do we know about that variant? Obviously, there's going to be some headlines and some reporters like me talking about this today. What's the message in terms of what we know about the variant? It seems as if the vaccines work against them, but I want to hear from Dr. Herlihy about what she knows about what's going on with that variant, what we understand about it.
Sure, it's a great question. So the information we have about this variant right now is pretty limited. Some of that information is from some early investigations that have been done, some of which haven't been published yet. Other aspects of what we believe might be true about this variant really come from indirect information. So we know that this India variant, the variant from India, the one that has been identified in Colorado, the 617.2, plus some of the other variants that have been circulating in India recently that are related to this one, have mutations that are shared with other variants of concern or other variants in general that have been identified across the globe. And so because of some of those shared mutations that have been seen, we know that there's a potential that this particular variant could be more transmissible because it shares these mutations with other variants that are more transmissible. We also know that there's some limited data that suggests that some of the monoclonal antibody treatments could potentially be less effective for this particular variant. There's very minimal data about vaccine effectiveness, and right now it looks like minimal impact to vaccine effectiveness with this particular variant.
Great, thank you. Joseph, you are our next question.
Hi, this is Joe Vaccarelli with Denver 7. Can you guys hear me?
Yes.
Okay, great. With so many of the new cases in Colorado showing up in children, what is the message to parents about getting the vaccine for their kids once it's approved and available?
Yeah, absolutely. So as I was sharing, some of the highest rates of infection that we are seeing right now are among Colorado children. We know that the vaccine is readily available to children who are 16 years of age and older. And so I would certainly encourage parents to vaccinate those children that fall in those age groups. We also are very hopeful that fairly soon, we've heard announcements as potentially as early as next week, there could be movement toward approval of vaccine for younger children, so in that 12 to 15 year age group. And so if that were to happen next week and the FDA approves the emergency use authorization for those younger age groups, we would certainly encourage parents to vaccinate children in that age group. And I think some of the trends that we're seeing now, I think really reinforce the importance of vaccination, not just for adults, but for children as well.
Great, thank you. John Ingold, over to you.
Hi, everyone. Yeah, it's John at the Colorado Sun. Thanks for taking my question. I wanted to ask about vaccine hesitancy, and I'm wondering how you think the effort against that is going. Are there areas where you feel like you're having success, or are there areas or communities where you think there's sort of more persistent hesitancy? And then specifically looking at the Eastern Plains counties, which all appear to have fairly low rates compared to the rest of the state. I'm wondering what you think is going on there and why those rates are not as high. Is that access or is that hesitancy?
This is Kate, and I can address some of the hesitancy questions. I know we've discussed this on media briefings before, but the Colorado Department of Public Health and Environment does have a proactive campaign going to really reach out to folks who might be hesitant. And we are really doing everything that we can to provide as many places where folks can get the vaccine as possible. We have an equity effort, and the equity team has also presented on all of the activities that they have. That is a big part of the strategy, is to ensure that people can conveniently access the vaccine in as many locations as possible throughout the state. So we have our community vaccine sites, but like I mentioned, we also have over 1,400 providers who are now enrolled. And folks can go to their providers looking for more information and be educated about the vaccine. And then we have also a partnership with FEMA in the southern and southeastern part of our state. They are running the site at Pueblo, but they are really focusing more on mobile bus routes in that area to get the vaccine out in that part of the state where we do know that we see a little bit less uptake. So there are a variety of efforts. We're really working closely with the governor's office to identify other efforts to get the word out and address hesitancy across our state.
Great, thank you. And before I go to second questions, anyone else have any first questions that they would like to ask? All right, Seth, over to you.
Thank you. Seth at the Gazette again. So talking about the rise in younger cases, Governor Polis said last week that he thinks, a lot of that is vaccinated parents taking their unvaccinated children to social events. I mean, is there something else driving this? Is this similar to levels that we saw maybe in previous peaks, but it looks worse because so much of the older population is vaccinated? What's going on here that's driving this trend this time? Thanks.
Thanks. That's a great question. And I think you're right on that. We probably would be seeing much broader transmission in different age groups if we didn't have the vaccine available right now. And we've been saying for weeks now that this fourth wave of illness is going to look different. And part of that is because of vaccine. So we know that we're seeing the lowest rates of infection right now in our most highly vaccinated communities, and whether that's a community defined by older populations or a community defined geographically. So I've shared data with previously that shows that counties where we see the highest vaccination rates are the counties where we're seeing the lowest infection rates right now. And then again, I've shared with data about age group trends in cases where we're seeing the lowest case rates among our most highly vaccinated population. And so absolutely, I believe that part of the reason that we are seeing more transmission in our younger populations is because our older populations are more highly vaccinated and protected right now. And again, I think this reinforces that message that children need to be vaccinated too, as soon as the vaccine is eligible for their particular age group, whether that's 16 and older right now, or 12 to 15-year-olds who are hopefully going to be eligible soon.
Great, thank you. Chris.
Yep, Chris Vanderveen again with 9 News. My question, I asked this question a couple weeks ago, and the numbers, the hospitalization numbers have really stayed stubbornly high, and they really have not gone down over a sustained period of time. In fact, we're still well over 600 as of last count yesterday. Do we have a better understanding as to why that patient count number continues to sort of slide up, if ever so slightly? We're still not seeing any sort of downturn in patient counts at this time.
Yeah, so for the most part, I would say that our hospitalization trends are really tracking with our case trends. So, while we've seen a slight improvement in case trends in just the last couple of days, we've not really seen that clear trend yet with our hospitalizations. But that's pretty typical for what we see in our surveillance data, where we see typically our case trends or our percent positivity laboratory trends move first in a direction, whether that's up or down. And then a week or two later, we start to see changes in our hospitalization trends or even our death trends after that. So I think it's not surprising to me that right now, while we're starting to see some stabilization in our case numbers, and again, I'm still not feeling super confident that those stabilizations are going to hold over the next couple of days, but we'll see soon. It's not surprising to me that we're really continuing to see hospitalizations continue to go up. If this is a true decrease in cases that we are seeing, and we continue to see that for the next several days, I would expect to see an improvement in some of those hospitalization numbers over time.
Great. All right. I think, Frida, you jumped in your first question, so I'm going to go ahead and go over to you.
Thank you. Frida Micklin with the Villager newspaper. I'm wondering if you know the average age of the people who are currently hospitalized.
Yes, I can get back to you on that in just a minute. I do know that when we looked at this a couple of days ago, it was on average about 10 years younger now than it was earlier in the pandemic, but I can get you the exact number in just a minute.
Okay, thank you.
And Frida, we can send that to you from the media info email.
Perfect. No problem. Thanks.
All right. I have one more question. I'm going to go ahead and take Meg.
Look, I just wanted to clarify with Dr. Klein. You had talked about, it's a very personal decision, but that you women to get vaccinated. Is that any different than how you would encourage someone who's not pregnant, or is there something about that decision that at that period of life that makes it a little different?
Well, that's a great question. Pregnant women are always very cautious about putting anything into their bodies, and any treatment that we recommend, they're usually going to ask, is this safe for the baby? I'm very used to talking to patients about different medications and what could the benefit of that medication be, what's the possible risk to the baby. And so we talk about that with the vaccine as well. There's, a little bit of an unknown because we're going to need probably years of giving this vaccine to pregnant women before we get huge amounts of data, whether there could be any very small risks to the fetus. But at this point, we just base that on the biological mechanism of the vaccine and then what we know about the actual COVID infection. And so when I talk to patients, I think we know that COVID-19 infection is very dangerous for pregnant women. And so we think that based on all the information we have, the vaccine is much safer. So yeah, I think there's always another layer of that decision-making in a pregnant woman.
Thank you.
Great, thank you. And with that, we're out of time for today. If you have a question that comes up later, if we didn't get to your second or third question, go ahead and send those over to media_info@state.co.us, and we'll help get you some answers. And with that, I want to thank all of our presenters so much, as well as our interpreters, and I hope that you all have a great rest of your day. Thank you.